Good day, everyone. Again, it's Dr. Ashley, and welcome to another Law Topic lecture. Today, we're going to talk about Class A pharmacy. Class A pharmacy is going to be a big topic for us to cover today. I know there's a lot of rules and regulations out there set forth by the Texas State Board of Pharmacy, and I feel like, or from personal experience, especially on my MPJE test a few years back, well, a lot of years back, a lot of the questions actually came from community pharmacy. So I just wanted to give you guys a heads up on that. Buckle up, sit tight, grab your notes, and let's get going for a pretty good lecture today. One of the most important roles in a Class A pharmacy is the pharmacist in charge. I would pretty much call these folks the captain of the ship in the community pharmacy world. I've had the pleasure of serving as PIC, or pharmacist in charge, for an HEB pharmacy for over 5.5 years in Central Texas. And let me be the first to tell you, that was probably one of the most hardest, but also at the same time one of the most rewarding jobs that I've ever had in my profession. I was younger at the time and learned a lot. I supervised 32 employees, from technicians to pharmacists to cashiers to delivery drivers in that time. My pharmacy that I served as PIC for filled over 5,500 prescriptions a week. So we were pretty busy, shucking pills, counting by fives left and rights, counseling, all the things above. But I learned a lot. I learned a lot about myself. I learned a lot about the profession. I learned a lot how to work with other people. And supervising is something that's rarely taught in pharmacy school, at least to an extent to help you understand. So a lot of it's just kind of on the fly learning. But the experience that I gained from having that role and serving as a PIC was pretty rewarding and beneficial, and rewarding for my growth as a pharmacist. So when you're going out on your API rotations and you have your advanced community rotation, ask some questions to the PIC. I'm sure they can give you some do's and don'ts out there, and maybe to share some stories about their experience as being a PIC. But something definitely to consider for those that might be interested in community pharmacy once you graduate pharmacy school. Like I said, very good role, very good way to serve your profession, but it does take a lot of work. So let's get into the meat of it real quick. Each Class A pharmacy shall have one PIC who is employed on a full-time basis. And of course, with everything else, there's there's some caveats to that. Generally, the PIC may only be a PIC of one Class A pharmacy unless the additional Class A pharmacy is not open at the same time. During an emergency, the PIC may serve as the PIC for two Class A pharmacies open at the same time if he or she works at least 10 hours per week in each pharmacy, no more than 30 consecutive days. Some examples of that last one can be where, in situations where I've witnessed maybe a pharmacy manager or PIC has passed away, and another manager or PIC basically had to help run that store temporarily, just until somebody could get in there to take their place. So unfortunate things do happen, but at least the board does have a rule or a law in effect where a PIC can serve two places just to help out a company or a situation where that's needed. Responsibilities of a PIC, first and foremost, they are responsible for the legal operation of the pharmacy. And then second, they are responsible for educating and training pharmacy technicians. When you think of big box stores like Brookshire, CVS, Walgreens, HEB, Walmart, and even down to the independents, they're all owned by somebody, right? Well, in the state of Texas, the owner does not have to be a licensed pharmacist. However, a lot of times, especially when you're talking about an independent pharmacy, that owner is the PIC. The owner of the pharmacy has the responsibility for all administrative and operational functions of the pharmacy. Just remember that if the owner is not a pharmacist, they have to consult with the pharmacist in charge or another pharmacist before they can establish any policies or procedures to help run that pharmacy. Just with like any other class of pharmacy in the state of Texas, you have your support pharmacist or your staff pharmacist, and they are very important to the pharmacist in charge or the pharmacy manager or the PIC or whatever you want to call them, and making sure that that pharmacy is running and operating as smooth as possible, and it also is running under the accordance and the laws and rules set forth by the Texas State Board of Pharmacy. So first of all, a Class A pharmacist needs to be there to assist the PIC and is required to operate the Class A pharmacy competently, safely, and adequately to meet the needs of patients of the pharmacy. They are also responsible for the direct supervision of pharmacy technicians, trainees, and other support staff. Their supervision can be done so electronically if the pharmacist is on site in that pharmacy. They can have the opportunity to directly communicate with the technician that might be working with them. and they can have immediate access to any of the original documents out there that they might be verifying. So can be done. And then lastly, for a Class A pharmacist, can also be called a dispensing pharmacist. Ultimately, what that means is they are responsible for ensuring that the drugs are dispensed safely and accurately as prescribed, unless the pharmacy's computer system can identify each pharmacist involved in the different steps of the dispensing. So what that's saying is that a dispensing pharmacist is a pharmacist that gives the final verification check of a prescription before it's dispensed to a patient. And then the last part of that statement is saying that during the dispensing process, any step that's completed has to be notated by whoever completed that step. And so a lot of times with computer systems nowadays, each step, so data entry, product pulling and filling or dispensing, and verification is all kept track of, and whoever completes that step will be notified or notated in the computer system. So a lot of responsibilities for a Class A pharmacist, but they are there ultimately to help run the show, help the PIC get their job done, and make sure that the patients are taken care of to the best of their ability. Duties which may be performed only by a licensed pharmacy in Texas include the following: receiving oral prescription drug orders and reducing these orders to writing, interpreting prescription drug orders, because we all know that doctors out there have the best handwriting and it's super easy to read what they wrote. So ultimately, it's the pharmacist's final discretion of what that drug or that prescription says. And at the end of the day, if you don't know or can't understand what that says, you better give the doctor a call. They're also responsible for selecting drug products. So a lot of times what that means is when you have a brand name drug, and with Texas we can substitute generically. And a lot of times brand drugs out there have about 50 different types of generic drugs based on manufacturers and NDCs and all kinds of things out there, but the pharmacist has the ultimate discretion of what drug is selected during dispensing. They're responsible for performing the final check of a dispensed prescription, of course responsible for patient counseling, assuring that a reasonable effort is made to obtain record and maintain patient medication records. So when a patient drops off a prescription and they are a new patient to the pharmacy, ultimately they're responsible for obtaining the address, date of birth, insurance information, allergy information, disease state management information if that's an option, whatever the case may be, but they need to make sure that the patient's record is filled out completely. Responsible for performing drug therapy management under protocol if that's an option. A lot of times in different types of clinic site pharmacies, you might have ability for community pharmacists to help with diabetes management or provide diabetic education courses. It's just an option out there. Traditionally, it's one that's gaining momentum these days in the community pharmacy world. Responsible for verifying that controlled substances listed on invoices are received by initially and dating the invoices. And lastly, they are responsible for transferring or receiving a transfer of a prescription. Just note on that while most of these duties listed above may be performed by an intern working under a preceptor, the transfer of a prescription requires at least one pharmacist to be involved. So transfer from an intern to a pharmacist or from a pharmacist to an intern is permitted. However, but no two transfers between drugs can be done by two interns. And so as we mentioned before, if that pharmacist is a preceptor, the duties listed above can also be performed by an intern working under that preceptor at that preceptor's discretion. So that's that little caveat there that you see by the asterisk. Even though it says pharmacist only duties, if it's a licensed intern working under a preceptor, then they can complete those duties as listed as well. Now let's talk a little bit about our Class A pharmacy technician and technician trainees. And now these are individuals working in the pharmacy whose responsibilities are to provide non-judgmental technical services associated with the dispensing of a prescription drug order. A reason I put the pharmacy glue right there is because being a pharmacist and being a pharmacy manager in my past history, man, there are technicians and trainees that you have working with you and under you and for you basically help dictate and run the livelihood of that pharmacy. If you have good technicians that work for you, if you praise them, if you help them, if you just be there for them when they need you, and not only professionally, but just helping them get their job done in whatever capacity that may be, it ultimately makes your business run smoothly. So they are special people that ultimately help you be the best pharmacist that you can be. Just want to be a little side note here that I know we talked about technicians, certified technicians, and then technician trainees. In Class A pharmacy in Texas, there are no differences between the duties of a pharmacy technician and a pharmacy technician trainee. So ultimately, depending on what's going on. So if it's data entry or typing a prescription or pulling product from the shelf and filling a prescription, since those are technician duties, the trainee and the technician that's certified can do that. So there's no difference in between the two. As we previously mentioned, we know that technicians and trainees are really important to the pharmacy, the pharmacist, and really help that make that pharmacy go around. But let's talk about some of the duties that they can perform through Class A pharmacy in the state of Texas. First, they are able to initiate and receive refill authorization requests, so that can be done verbally through a nurse or a doctor or one of their agents. So if it's a previously filled prescription at the pharmacy and the doctor's just basically adding more fills to that fill, a technician or trainee can take those. They are also able to initiate electronic transfer requests between pharmacies sharing a common database. So a good example of that, some of the bigger chains like Brookshire, CVS, Walgreens, Walmart, HEB, those, regardless of how many stores they have in their company, a lot of times those databases they have that carry their prescription information can be accessed anywhere. So just because I fill one prescription at one pharmacy doesn't mean that I can't fill it in another pharmacy because the records are all linked together. So a good example of how that's used is, say for instance, I fill a prescription usually at a Brookshire's on the south side of town, and I'm on the north side of town that day, and I need to refill my blood pressure medication. Well, I can actually go to the pharmacy, talk to the technician that might be working the drop-off window at that pharmacy, tell them my situation, and they can actually pull my record and transfer that record electronically to that pharmacy, and they are able to fill it there for me as a convenience. So just a pretty cool duty that they are able to do. They're also able, of course, to enter prescription data into a computer system. It was, as we talked about before, as a pharmacist role, of course, the pharmacist has the ultimate decision of what, or deciphering of what that prescription says. So if a technician or a trainee has any questions, of course, they need to verify with the pharmacist before entering it. They're able to take a stock bottle from the shelf for a prescription. They can prepare that prescription, so count it out, pour the liquid out, measure it out to whatever quantity it needs to be, and then package that drug order in that bottle or glass bottle or whatever syringe or however it needs to be prepared as directed. They're able to affix prescription labels to those preparations and even auxiliary labels as well. And so what an auxiliary label is for instance, say a technician pours a suspension liquid into a bottle. A lot of times with suspension, of course, we need to make sure that we shake it really good before we dispense it to ensure the concentration is evenly dispersed throughout that medication. So they can basically put a shake wheel sticker on that bottle, or if it was an insulin that needs to be dispensed to a patient, they can put refrigerate before opening on that prescription. So things like that, those extra labels that aren't traditionally associated with the original prescription label. They can reconstitute medications, which I feel is super important, especially during cough and cold season when a lot of antibiotics are being dispensed. Antibiotic prescriptions usually are packaged in the pharmacy as powder form until the patient arrives to pick it up. Once the patient arrives, then a technician can actually measure out the amount of sterile water needed to fulfill the concentration of that prescription, of course, after they are trained to do so. And then that way they can shake it up, mix it well for the patient, and then dispense it that way after it's been verified. So just another cool opportunity that they have in the pharmacy. They're able to load bulk drugs into an automated counting device or dispensing device, provided that a pharmacist verifies that device is properly loaded prior to use, ultimately just to ensure that the patient gets the right medication. They're able to bulk compound, especially through non-sterile preparations. And a lot of the non-sterile preparations that you see in Class A pharmacy are like mouthwashes, like Magic mouthwash that are good to treat ulcers or ulcers within the esophagus or things like that, or sometimes like butt creams or like Happy Hiney, a lot of times used for diaper rash. So those are the common ones that you see. Hot topics to think about right now, especially with the technician roles and duties, is that the state board is always constantly evaluating those to ensure that the technicians and trainees are operating and supporting the pharmacy as best as they can. So I wouldn't be surprised if the technician and trainees duties got expanded within the next couple of years to allow them to do more for the pharmacy and for the pharmacist. So just stay on the lookout for that. I know for sure they're looking at some of the additions to add to their list of duties this year. So stay tuned. In Class A pharmacy, there is a pharmacist to technician ratio, and that ratio is 1 to 4. With that being said, at least one of the technicians in that ratio has to be a registered technician through the state of Texas. Sometimes or some pharmacies might have a lot of technician trainees, maybe one day with hopes of becoming a certified technician, but they don't have a registered technician on staff. In that case, the ratio for them drops down to 1 to 3. Another hot topic that's going to be considered by the Texas State Board of Pharmacy this year is reevaluating that ratio. Currently, right now in Class C pharmacy in the state of Texas, there's not a ratio of pharmacists to technicians. So ultimately, there can be any amount of technicians working under a pharmacist. However, in retail pharmacy, there is that limitation, but that's also being evaluated to ensure, one, if there can be an added amount of technicians to that pharmacist to technician ratio to help that pharmacist or that pharmacy run better, run smoother, or just basically help run at its best ability of its best to its best of its ability to help the customer basis and get them the prescriptions that they need at the best time possible. The Texas State Board of Pharmacy also enforces some environmental requirements that is needed for a Class A pharmacy. First, it needs to be clean and orderly, so no junk, no papers laying anywhere, things like that, counters cleaned, disinfected, so on and so forth. The pharmacy must have a sink in the pharmacy, and that has to be a sink separate from a bathroom. Some older pharmacy styles used to actually have a bathroom in the pharmacy just because of convenience factors, but then ultimately those have been most recently taken out of the pharmacies, and they just have a sink in there. But the important thing about that sink is that it must have hot and cold running water. The area must also be suitable for and contain a place to provide confidential patient counseling. So with HIPAA laws and regulations out there, you want to make sure that you do counsel patients in an area that's away from other customers and in an area that they feel confident and comfortable that the information that you're telling them is only between you and them as best to your ability. So some pharmacy examples out there, as you might have seen already on rotation or when you get on your appies, are all laid out differently. Some have awesome counseling areas, some don't have a really good counseling area at all. And so just use your professional judgment when you need to tell a patient some information about their medication. Depending on the sensitivity of that information, if you need to pull them aside in a different area outside of the rinky-dink counseling area that's available, you have the right to do so. So just know that you have the ability to do that. Proper lighting and ventilation with temperature and range with proper drug storage also needs to be accomplished. So think about it. Drugs have different temperature ranges that they are stable at. You don't want the pharmacy to be super hot. You don't want the pharmacy to, a lot of times, to be super cold, because that's really a poor working environment for some of your employees, even though I prefer to work in really cold environments because I'm so hot-natured. But just make sure that that temperature is working right. Also, the temperature of the refrigerator shall be maintained within a range compatible with storage requirements. So a lot of pharmacies will have a refrigerator with a temperature log on the front of it. A lot of companies require that log to be maintained at least twice a day, so document temperatures on that twice a day to ensure that that refrigerator is working. Like I said many times before, it's 2020 with technology running rampant again. Now available, they have digital thermometers that are linked to a computer system. So if there's a temperature decrease or increase, it's pretty drastic. A lot of times that the pharmacies or the supervisors of PICs will be notified of that, so that way they can check out the refrigerator and change it or get it fixed, whatever needs to happen. This is a funny one, but it's so true. Animals, including birds and reptiles, shall not be kept within the pharmacy and in immediate adjacent areas under the pharmacy's control. So you might think of, I don't know, some people might want to betta fish in the pharmacy because that just sounds like a fun idea, but that's actually against the law, so don't do that. And then also in the pharmacy, there has to be a designated area for flammable materials. That way it keeps away from customers, keeps out of the hands of the people that don't need to touch it, and keeps it away from having the ability to blow up when it doesn't need to. So just remember these environmental requirements. Inventories of medications across Class A pharmacies vary. Some have a lot of controlled substances, some just contain a lot of drug inventory or high dollar inventory. The state board, of course, acknowledges that, and they have security requirements that need to be put in place in any prescription department or pharmacy, and we're going to talk about those right now. Of course, these only apply to pharmacies that possess drugs, so have that inventory available. First being that the prescription department must be locked by key, combination, or other mechanical or electronic means to prohibit unauthorized access. So just making sure that just no random person can walk up in there, ultimately take what they want and leave. So it needs to be locked and secured. The pharmacy's key, combination, or means of locking the pharmacy may not be duplicated. At minimum, the pharmacy must have a basic alarm system with off-site monitoring and motion detectors. And lastly, the PIC or owner may authorize individuals to enter the prescription department or pharmacy to perform functions other than dispensing. However, the PIC or owner must maintain written documentation of authorized individuals other than individuals employed by the pharmacy who access the prescription department when a pharmacist is not on site. I know that's a mouthful, and we'll talk about that in just a little bit on what situation that might occur in. And ultimately, every pharmacy needs to have or must have policies and procedures written in place for the security, and those need to be reviewed by all personnel that work in that pharmacy, minimum on an annual basis. But again, that depends on the company that the personnel works for. I know you probably all heard the wise tale that when you become a retail pharmacist and you learn how to hold your bladder, but sometimes you still have to go to the bathroom, and a lot of times you still have to eat because your blood sugar will get low during a 12-hour shift, I promise you. So there are times in at least when that does happen, and the state board recognizes that, and they have actually put laws into place that are involved the temporary absence of a pharmacist. Note this does apply when there's when there's only one pharmacist on duty in that pharmacy. So you can break it up in two different types of absences. The first being when the pharmacist is on site, and this is for breaks and meals without closing the pharmacy. So they're still on the premises and they are just readily available, but just have stepped out maybe for a second to get something to eat, or they've stepped in the back of the pharmacy to eat whatever food they brought, or whatever the case may be. But for that to occur, at least one pharmacy technician, and it can't be a trainee, remains in the pharmacy during this time. The pharmacist must remain on the premises of the facility, which means if they're hungry, they didn't bring anything for lunch. If it's a grocery store, they can go to the deli in the store, that's fine. But what they cannot do is run down to the street to Taco Bell to get their meal and then come back to the pharmacy. That's considered a no-no for this. Before the pharmacist leaves temporarily, they must put a posted note at the drop-off or pickup window that the pharmacist is on break. A lot of times those signs have a time of when the pharmacist will return. Just note it so the customers know that there is a pharmacist there. They just stepped out. Technicians and trainees can continue to work, but all acts, tasks, and functions must be verified upon the pharmacist's return. So basically what that means is if a new patient comes, drops off a prescription, the techs can work on it, they can type it, they can fill it, but the pharmacist has to be there to verify it before it's dispensed. So if the pharmacist is unavailable at that time because they stepped out, the patient is going to have to wait until that pharmacist gets back to verify what was dropped off and make sure that it is accurate and able to give to that patient. During the absence, a pharmacist intern is considered a registered pharmacy technician, so they can't perform any pharmacist-like duties or pretend they're a pharmacist, of course, until the pharmacist comes back. And then lastly, patients may pick up prescriptions that have already been filled and checked by the pharmacist before they went on break or when they went to get something to eat or whatever the case may be. So that's totally fine, not a problem at all, because it's already been checked, so it can be dispensed. The other type of temporary absence that you might see of a pharmacist is when the pharmacist is off-site. So a lot of times deemed when the prescription department or the pharmacy is closed. If the pharmacist leaves the premises of the facility, the prescription department must be closed and the pharmacy technicians may not remain in the pharmacy. However, this rule does allow delivery of filled prescriptions under certain conditions after the pharmacy department has closed. During short periods of time when a pharmacist is absent from the pharmacy, an agent of the pharmacist may deliver a previously verified prescription, new or refill, to a patient in the pharmacy, provided the short periods of time do not exceed 2 consecutive hours in a 24-hour period. So in other words, a lot of times this agent that it's referring to might be a manager of a chain grocery store or chain department store that has a pharmacy within it, and they're the ones that are allowed or can be allowed to go into the pharmacy to obtain a prescription to be delivered to a patient after the pharmacy is closed. So that's just kind of an example of that. Basically what happens then, if that does occur, the pharmacy must maintain a record of the date of the delivery, the prescription number that was dispensed, the patient's name and phone number, and the signature of the person that's picking up that prescription. The pharmacy must also meet the same requirements of the prescription delivered to a patient at the patient's residence. So basically, it needs to be treated as a delivered prescription. And then lastly, the pharmacy may also use an automated storage and distribution device like a kiosk to deliver prescriptions. This is not, however, restricted in the 2-hour limitation, and this is a newer thing that's becoming more, I guess, available these days in bigger chains that are out there, to where you go up to a kiosk, you put in your information, your date of birth and whatnot, and it will actually basically spit out or dispense your prescription from a machine. So new technology that's definitely out there, that I haven't seen yet personally, but I know that a lot of the chains are exploring how to accomplish that, because if you think about it, some grocery store chains out there might have stores with pharmacies and some that do not have pharmacies. Well, this would be a perfect opportunity to put a kiosk in one of the stores that don't have a pharmacy, maybe to service patients in a more rural area. So just something to think about. As far as the rule that we just talked about, when a pharmacist designates an agent to go into the pharmacy, a lot of times that might be seen more in a grocery store setting, to where the pharmacy department closes earlier than when the traditional big store closes. Even though this can happen, I've never personally seen it happen before. Not saying that it's something that won't be done, but I think it's just a rule that the State Board of Pharmacy has. It's probably going to be more explored, I would say, probably more in the future. But just know that it can occur. But I think the most important thing to take away from this slide is that if the pharmacist is not there and they're off site, they're out of the premise whatsoever, that any personnel, so technicians and trainees, cannot stay within the pharmacy. So big thing is take that away. Patient counseling is super important in the state of Texas, and the Texas State Board of Pharmacy thinks so as well. So just know this statement right here that I'm about to tell you guys is super important. So memorize it and take it to heart. Okay, so here goes. Mandatory patient counseling is required for all new prescription drug orders in the state of Texas. Okay, super important. So what does a new drug order in the state of Texas mean, right? Well, that's deemed to be a prescription or a drug that has not been dispensed by the pharmacy to the patient in the same dosage and strength within the last year. Okay, very important. During a counsel session with the patient, information that's provided, which basically what the pharmacist deems most significant about that prescription, they use their professional judgment, making sure that they tell the patient what they think is most important. If you think about it, in the real world, in the community setting, there's not a lot of time to counsel patients. I know in school we learn the long drawn out way, but ultimately, if you think about it, in community pharmacy world, you really have 30 seconds to 45 seconds to tell the patient everything they need to know about the medication. So just kind of take that in the back of your mind. That is the real life version. Don't tell your other professionals I told you that, but that's what really happens. And I feel like when you get on your APPEs, especially in your advanced community rotation, you will see that. The pharmacy must document initials or identification code of the pharmacist providing counseling, either on the actual hard copy of the prescription or it's documented somewhere in the computer system. So just as a pharmacist documents that they counseled a patient, they also have to document the prescriptions that the patient's refused on. So both have to be documented. So know that. In Texas, only a licensed pharmacist or supervised intern can provide counseling. So a lot of times in the stores and in the pharmacies, the technicians will be the forefront of the pharmacy because they're the most readily available, depending on where they're working. So it's just natural for a patient to come up and ask them questions and want recommendations. So if you're working as a pharmacist or an intern and you hear that happening in front of you, make sure you step in and politely just basically inform the patient, that, hey, I heard you had a question, I can answer it for you. You don't want to do it in a way that kind of belittles the technician, because ultimately they're there trying to help and provide good customer service. But at the same time, they shouldn't be answering questions or making recommendations. That's not their job duty. That's the pharmacist or the intern's responsibility. So just know that. Also, in Texas, there's no such thing as an offer to counsel. So I'm gonna give you guys two different statements, and one's gonna be wrong and one's gonna be right. Okay? So here's the wrong one. You have a new prescription here. Would you like to speak to the pharmacist about your medication? So you can see how that's a question, right? That's more of an offer to counsel, which is incorrect. So the correct statement would be, you have a new prescription. The pharmacist would like to talk to you about your prescription. Would you please step over here? So you can see the second example is more directive. So that's not giving the patient an offer to cancel. That's basically telling the patient that they need to be canceled by the pharmacist. And at that time, depending on the patient's situation, they can either refuse or accept the offer for the patient to cancel. So just know that. As we mentioned before, of course, the information that's provided during counseling is based on the pharmacist's professional judgment. But some of that information may include the following. Of course, is the name and the description of the drug or device, the dosage form, dosage, route of administration, and duration of drug therapy, special directions and precautions for preparation, administration, and or use by the patient, common side effects or adverse effects or interactions and therapeutic contraindications that may be encountered, including their avoidance and their action required if they occur, techniques for self-monitoring of drug therapy, proper storage, refill information, and actions to be taken in case a dose is missed. So those are just some things to share during a counseling session. As we recently learned, the State Board of Pharmacy does allow prescriptions to be delivered to patients when a pharmacist is either off-site or through the Class E pharmacy route when a prescription is mailed to a patient to their home, and those are considered to be delivery off-site prescriptions, okay? So on these prescriptions, when those situations do occur, documentation on the prescription container or on a separate sheet in both English and Spanish, the local and, if applicable, toll-free telephone number of the pharmacy must be included, and this following statement. Written information about this prescription has been provided to you. Please read this information before you take the medication. If you have a question concerning this prescription, a pharmacist is available during normal business hours to answer these questions at and then the pharmacy's phone number or the local telephone number or toll-free number that you can reach a pharmacist. So this is really important, especially because there are situations now, especially with the profession of pharmacy and the way that it's progressing, as we talked about. There's new means of getting prescriptions to patients without the pharmacist actually being there. So these laws are put in place to make sure that the patient does get counseled in some form or fashion with the information provided by the prescription. Now, when prescriptions are delivered either through mail order or through a delivery service, they still have to be maintained, and the use of adequate shipment containers have to be used to ensure that drugs are kept in appropriate temperature ranges. As we learned earlier when we talked about the environment of a Class A pharmacy, temperature is very important to maintain, especially for certain refrigerated drugs and for certain drugs that just can't have exposure to high temperatures. That can denature the drug and make it inactive. So that cold chain has to be maintained through a delivery. And then lastly, even with the use of a delivery prescription, there has to be a process in place where when the prescription is delivered, the process needs to ensure that the delivery has been made to the correct patient and that the patient gets the correct prescription. So if that's some type of identification verification, or if the patient needs to sign for it, or they have to make some type of identification verification through telephone or whatever they might be, the processes seem to vary across all forms of delivery reciprocals. But just know that it does have to be completed, and ultimately at the end of the day, the goal is to make sure the patient gets the right drug. On a previous slide, we learned that one of the duties of a pharmacist is to perform a drug regimen review. It's required for all prescriptions new and refilled in the state of Texas. At minimum, the pharmacist shall review and identify clinically significant known allergies, rational therapeutic contraindications, reasonable dose and route of administration, reasonable directions for use, duplications of therapy, drug-drug interactions, drug-food interactions, drug-disease interactions, any adverse reactions, and proper utilization, including overutilization and underutilization. The pharmacist should take the appropriate steps to ensure that any of these, if there is an issue, the issue is avoided, and to resolve any issues that come up appropriately. It includes, making sure that if anything needs to be asked of the patient as far as allergies goes or disease state history, that's taken care of, and if there are any significant reactions or interactions or topics that need to be addressed, that the prescriber is consulted. So one of the important things to note that if you do come up with an issue during a drug regimen review and it does require more information gathered from the prescriber, make sure that resolution or that information that you obtain from the prescriber is documented. So things that you want to take in consideration when documenting a change or a recommendation or a resolution is the date that was obtained, the person who you communicated with at the prescriber's office, or the new prescriber's instructions, or whatever the case may be there. Whatever the documentation entails, it can be short, it can be sweet, it could be a novel, it could be whatever, just to note that when you do go back and you have a question about that documentation, it can be incomplete, it can be concise, and it can be interpreted correctly. And then lastly, the initials or the ID code of the consulting pharmacist that basically gathered the additional information from the prescriber to ensure the validity and the accuracy of that prescription before it's filled and then administered to the patient. In the state of Texas, generic permissive drug substitution is allowed. An example of that is when a doctor, say, writes a prescription for Xanax 0.5 milligrams, the pharmacy is allowed to dispense alprazolam 0.5 milligrams without having to contact anybody. But there are some things that have to be done if that drug is basically permissively substituted. First, the cost of the drug or the generic that's dispensed has to be less than the brand name. The patient does not refuse the substitution, so even though you fill it automatically for the generic, but if the patient wants brand, you have to fill the brand name of the drug. So in this case, it would be the Xanax. And then lastly, to be able to do the permissive substitution, the doctor can't put on there or on the prescription any type of prohibited message saying like brand medically necessary or dispense as written. If that's the case, if they do that, you have to legally dispense the patient the brand name drug. So if that's on there, in this case or example, the pharmacist would have to dispense Xanax for the patient. When a pharmacist is performing permissive substitution, there are three things that have to happen, right? So first thing has to be that the patient has to be notified. So the pharmacist must inform the patient that a less expensive generic drug is available. A lot of times the technicians help with this at the drop-off of a prescription. They will ask the patient if the generic version is okay, and at that point in time, the patient can answer. Also, that the pharmacist has to be in communication with the prescriber. So if there's any situations where the patient might want a brand name of a drug or whatever the case may be, as long as the prescriber's in the know, that meets that requirement. Third is the selection of the drug product. So like we talked about before, some brand name drugs out there have about 50 different generic versions. And a lot of the dispensing systems out there in Class A pharmacy do a really good job of linking the therapeutic equivalent drugs together. However, sometimes you have to get away from that and look within the Orange Book or the FDA's version of the book that allows for drugs to be therapeutically interchanged. So get very familiar with the Orange Book. It's a very good reference to remember, especially in situations like this when you might have an off-the-wall generic for a brand name drug and it's not in the Orange Book, or it's not in your computer system, it's in the Orange Book. So just note, within the Orange Book, only A-rated equivalent drugs can be therapeutically interchanged. So if you have that prescription of Xanax and you have 14 different versions of alprazolam, you can look in the Orange Book to see which ones are A-rated, and those are the ones that you can actually therapeutically sub for, okay? And then lastly, on the prescription label in the state of Texas, it must have on there where the name of the drug that it was substituted for, or so an example, it might be alprazolam substituted for Xanax, or whatever the case may be, or it could just have a simple statement of saying substituted for the brand prescribed, and then it might have the brand in parentheses like Xanax. So all those four things have to be met in the state of Texas to be able to perform generic drug substitution or permissive drug substitution. Another situation that might come up in Class A pharmacy is the substitution of a dosage form. Sometimes it can be capsules versus tablets, or even tablets versus liquid, whatever the case may be, but the state board does have a law in place that allows that to happen if needed, but there are just certain things that we have to meet. So a pharmacist may dispense, with the patient's consent and notification to the prescriber, a dosage form of a drug product different from what's prescribed, such as a tablet instead of a capsule or a liquid instead of a tablet. The pharmacist's requirements include the following. It must contain the identical amount of active ingredient as a dosage prescribed. The due dosage form is not enteric coated or time-release product if that was what was not initially prescribed. And then lastly, it cannot alter any clinical outcomes. So as long as those three things are met, if the patient's notified with their consent and the doctor is notified after it's completed, then you are able to substitute a dosage form just fine. Couple of different topics that we're going to talk about on this side. The first one being, say for instance you have a patient that picked up their prescription a couple of weeks ago. Well, ultimately, whatever happened in those 2 weeks, they deemed that it wasn't necessary for them to have that prescription, and then they report back to your pharmacy wanting to get a refund or see if they can return it. According to the Health and Safety Code, a pharmacist cannot accept back any unused prescription or drug that has been originally dispensed or sold in the state of Texas. So a lot of times this is a very touchy point for a pharmacist in charge with their patients. Patient situations vary all the way across the board, but it's a really hard conversation to have sometimes. But ultimately, if a patient wants to return a prescription in the state of Texas, the answer is no, because it's against the law. You can't return it back. A lot of reason behind that law is because once a prescription leaves, you don't know what's happened to it. If it's been in the hot car for 17 days and it doesn't work anymore, or if it was an insulin prescription and it hasn't been refrigerated, or you just don't know what's happened to that medication. So basically, it's unsafe to dispense it to somebody else. So ultimately, there are some customer service issues out there that can be resolved, but for purposes of this lecture, we're not going to get into those. So just note that if a patient wants to return a prescription back to the pharmacy, the answer is no. It's against the law. Another situation we're going to talk about on this slide is when prescriptions need to be returned to stock. So think about it, you fill prescriptions all day long and they go to the delivery area of the pharmacy, but they just sit there and they sit there and they sit there and they never get picked up. So basically, prescriptions that have not been picked up by or delivered to the patient or patient's agent can be returned to the pharmacy stock for dispensing. So RTS is another phrase you might hear in your community experience. It just means a fancy way of saying return to stock. Different companies, different pharmacy organizations that run a Class A pharmacy have different rules and regulations on what amount of time is needed. I know, like for instance, HEB guidelines are 7 days. It can be filled for 7 days before it's returned to stock. Berkshire's is a little bit linear. It could be 10 days. It just depends on the location that you're working. And the reason why for that is because a lot of those prescriptions are billed to insurance, and insurances don't like those to be billed as showing that they have been received by the patient if they in doubt have not. And so that's why a lot of times the return to stock process is maintained a little more closely for certain organizations than others. But just know that when a prescription is returned to stock, though, it cannot be put back within the manufacturer's original container. So once it's dispensed in one of your pharmacy vials, if that does need to be returned to stock, you cannot pour it back into the manufacturer vial. That's against the law. It has to be kept in that pharmacy vial that you dispensed it in, but note that it does contain the patient information on that vial still. It's important to remove that information and to make sure that it's not visible, so that can be used again with the dispensing. Also note that if you do fill a prescription and it's returned to stock, the expiration changes to 1 year from the date dispensed if it's outside its original container. So even though the manufacturer container might have a 3-year expiration date, once it's in that in that vial that's been RTS or returned to stock, it's only good from 1 year from the date that it was originally dispensed. So please know that. Prescriptions in Class A pharmacy have various expiration dates based on the type. So we're going to talk about those on this slide. So if a doctor prescribes you a traditional non-controlled legend prescription like a blood pressure medicine or a cholesterol medication, or an OTC prescription like a vitamin D or whatnot, those prescriptions are only valid or good for 12 months after the date it was issued. Now, if it was a controlled substance prescription scheduled 3 through 5, those actually expire 6 months after the date that it was issued or after it's been filled 5 times. So whichever one of those comes first. And then lastly, a C2 prescription is only valid 21 days after the date that it was issued or after the start date that was documented on the prescription. Just note that issue date counts as day 0, and it's 21 days after that day is the date that it will expire. Prescribers are allowed to add refills to legend prescriptions, OTC prescriptions, and controlled substance prescriptions that are Schedule 3 through Schedule 5. Schedule 2 prescriptions, however, are not allowed to have refills. There are ways to administer 3 different types of C2 prescriptions to a patient for them to get a 90-day supply, but for purposes of this lecture, we're not going to talk about that. If you get a hard copy prescription or even an electronic prescription and there's no refills indicated on that hard copy or electronic prescription, then there's going to be no refills for that prescription. However, you can call and talk to the prescriber if needed to get additional refills added. There are going to be certain situations when you're working in a community pharmacy. A lot of times this is during holiday time or on the weekends, and the doctor's offices are not open. You're going to get that frantic phone call from a patient that they're out of their blood pressure medicine, their blood pressure is extremely high, and they can't get a hold of their doctor and they don't know what to do. In situations like that, a pharmacist is able to allow an emergency refill of a 3-day supply of medication. They can do so if they deem that clinically relevant and that it's not going to interrupt the therapeutic progress of that patient. They can do this for legend drugs all the way up to C3 drugs. However, emergency loans are not valid for a C2 prescription, so just know that. So you might hear that term 3-day supply loan or whatever the case may be in your community API rotation, so that's what that is referring to. Sometimes those emergency refill or those loans can be extended, but a lot of times that only occurs during natural or man-made disasters, and those have to be declared by the governor, and the TSBP has to be given or has to give authorization to the pharmacies to participate in that, and that's when a 30-day supply can be administered to a patient. Just again, not C2s. C2s are not involved in this process. Other refill opportunities out there include auto refill programs. This is when basically a patient doesn't have to call into the pharmacy. The software loaded into the dispensing system at the pharmacy knows when a refill for a patient is due, and it'll automatically fill that refill. And when all the refills have been used, it even has the technology to contact the doctor and request a new prescription refill on the patient's behalf. So it's kind of a hands-off way to handle filling of prescriptions, but it's very convenient and useful for Class A pharmacies today. Just note for auto refill programs, you cannot put C2s or C3s on that program, but controlled substances 4s and 5, legends, and OTC prescriptions are just fine. And then last option for a refill is an accelerated refill program. So say for instance, a patient comes to your pharmacy with a lisinopril prescription. It's number 1 with 2. It's 1 fill with 2 refills. And that's for a quantity of 30 for each fill. Well, 1 with 2 refills is a total quantity of 90. So a 90-day supply with the patient consent can actually be accelerated, but just no more than a 90-day supply. Some caveats to that is that the patient has to be 18 years old. It only can be for a dangerous drug or a legend drug or an OTC drug. It can't be for any controlled substance. And the drug that is being requested to be accelerated cannot be a psychotropic drug. So anything for treatment of anxiety, depression, schizophrenia, any of those psychotic disease states, those are actually exempt from this accelerated refill rule. So just know that. The Texas State Board of Pharmacy does have requirements for equipment and supplies that must be located within a Class A pharmacy. At minimum, the pharmacy must have a data processing system including a printer, a refrigerator, child-resistant, light-resistant, tight, and if applicable, glass containers for dispensing, prescription, poison, and other applicable labels, metric and apothecary weight and measurement conversion charts, and a Class A prescription balance if the pharmacy compounds prescription drug orders. Class A pharmacy rules in Texas also require specific library references. These are as follows. The laws and rules, so basically the Texas Pharmacy Law book, can be online, can be in print, either way. Easiest way to find it is through the Texas State Board of Pharmacy. It's going to be online there. Pharmacies have to have one current general drug reference, so this can be Lexicomp, drug facts and comparisons, Micromedics, whatever it is, but it has to be readily available in the pharmacy. One veterinarian reference if the pharmacy dispenses veterinary medications, and basic antidote information and the poison control number posted somewhere, which is 1-800-222-1222. Now I put that number on there for a reason because that was actually a question on my MPJE when I took my law exam. So having to know that number by heart was important. A clinical service that Class A pharmacists can provide is providing immunizations. This requires a written protocol with the physician, and immunizations may only be given at a pharmacy or location provided in the protocol. Therefore, they cannot be provided where patients reside except for nursing homes or hospitals. In Texas, services to patients under the age of 14 may be provided with a physician's referral, therefore aka a valid prescription. There is a caveat to that though. The exception is the flu shot. The influenza vaccine may be administered to patients 7 years or older without a prescription, so just know that. Pharmacist certification, and like you guys, intern certification, is required through an ACPE approved course that includes basic cardiac life support certification, 20 hours of CDC training, which can be given to you through the APHA course that I'm sure you guys have all taken, And then when you become a pharmacist or a licensed pharmacist and a certified pharmacist immunizer, 3 hours of CE every 2 years is required, and this has to relate to disease states, drugs, and administration of immunization of vaccines. The last thing that you have to do is notify the prescribers. So a patient usually has 2 prescribers if they're coming in for a vaccine. They can have their primary care physician, which is the one that gave them a prescription for a vaccine, or they can get a vaccine under the protocol, and then they would be operating under the protocol doctor. Pharmacists are required to notify a physician who prescribes an immunization within 24 hours after administration. So this applies to the primary care doctor for the patient. However, if a patient comes in and they don't have a prescription from their primary care doctor, the pharmacist must notify the physician who issues the protocol within 24 hours of administration. And a lot of times on the consent form, when a patient fills out one to receive an immunization, there will be a blank to list their primary care physician. If there is a doctor listed in that blank, then it's required by state law that the pharmacist notify their primary care physician within 14 days of administration. In Class A pharmacy, there are 3 types of automated devices. First, you have your automated counting devices. Second, you have your automated pharmacy dispensing systems. And third, you'll see some automated checking devices. When you guys and gals go out on your advanced API rotation for community pharmacy, take note of what you see. Sometimes you might see Kirby Lesters used for counting, or sometimes you might see ScriptPro machines counting vials before they're actually verified dispensed by the pharmacist. One thing to note with all these devices is it's very important that there must be a method to calibrate and verify their accuracy. That has to be documented on a routine basis. A lot of times the State Board of Pharmacy requires it be done once, at least in a 12-month period. A lot of chains and other pharmacies out there that operate in Class A do so more often just to verify their accuracy. And then lastly, devices and containers in these machines may be loaded with bulk drugs only by a pharmacist, or can be done so by a technician or trainee under the direct supervision of a pharmacist. Let's spend a little time and talk about the pharmacy records that you might come across and how long and often they're supposed to be stored or kept in the pharmacy. Here are some general rules of records in Class A pharmacy that you need to be aware of. All records shall be maintained for at least 2 years. Any record pertaining to a controlled substance in Schedule 2 must be maintained separately from all other pharmacy records. Also, records for Schedule 3 through 5 drugs must be separate from all other pharmacy records or readily retrievable. And what readily retrievable means is kind of a gray area, but it can be asterisked, redlined, or identifiable in some manner in the pharmacy to where they can be readily retrievable. Patient medication records are required to be obtained and maintained for all new patients. They must have immediate retrieval of information for the previous 12 months from the initial date that they present with a prescription to dispense. The pharmacist in charge must assure that a reasonable effort is made to obtain record of at least the following information. When you think about these things, think of the patient profile that you might see in a community pharmacy. The name, address, and telephone number of the patient, the age and gender of the patient, any known allergies, drug reactions, chronic conditions, or disease states, other drugs currently being used by the patient, or also called their drug therapy profile, patient's comments regarding drug therapy, so any notes that patients might make on prescriptions or therapies that they've had in the past, or counsel notes, and then lastly, a list of all prescription drugs dispensed, new and refill, to the patient by the pharmacy during the last 2 years. A lot of times the new computer systems out there that these chain pharmacies have, this does this automatically. You can even go back further than 2 years if you need to look at dispensing history. So technology, again, is winning for us on this one. It's done so on their behalf. Speaking more about the pharmacy computer system, it's a great thing to have, and it really makes our job a lot easier these days. I know a lot of the older pharmacists who practiced back in the 70s and 80s can vouch for that statement as well. Anyways, pharmacy systems must be backed up at least monthly. A lot of chain pharmacies out there have protocols in place that actually back them up more often, usually every day or every 24 hours. The systems must also maintain any information purged from a computer for 2 years from the date of the initial data entry. Computers must have the capacity to produce a daily hard copy printout of the following: the prescription number, the date of dispensing, the patient name, the prescriber's name, the name and the strength of the drug dispensed, the quantity dispensed, the ID of the dispensing pharmacist, the ID of the technician performing any data entry, or for that fact, product dispensing. If this is not readily retrievable, it must include the patient's address, prescriber's DEA if controlled, the quantity dispensed, if different from quantity prescribed, the date of issuance, if different from the date dispensed, and the total number of refills date to dispense. And if there's any other changes made to the prescription as far as documentation changes or changes to therapy, direction, strength, whatever, those have to be able to be pulled from the computer system as well. To speak a little more on that daily hard copy printout that we mentioned in the previous slide, just note that it shall be produced within 72 hours of the date the prescriptions were dispensed. Each pharmacist who dispensed or refilled a prescription shall verify that information is correct by signing and dating the hard copy printout within 7 days from the date of dispensing. Nowadays, pharmacies don't even do that. They have maintained a logbook. And this daily logbook is one that pharmacists must sign daily. That eliminates them from having to sign the daily hard copy printout that we just mentioned above. But just note the computer system must still be able to produce an audit trail, which are the things that we talked about in the previous slide, within the 72 hours as requested. Each time a modification, change, or manipulation is made to a record of dispensing, documentation of such change shall be recorded in the computer system. The documentation of any modification, change, or manipulation to a record of dispensing shall include the identification of the individual responsible for the alteration. Pharmacies must also maintain a log of the unique initials or identification codes which will be used to identify each pharmacist, technician, or pharmacy technician trainee who is involved in the dispensing process in the pharmacy's data processing system. It's really important that these are maintained because the initials or identification code shall be used to ensure that each individual can be identified in the dispensing process. A lot of companies have various types of ways to basically give employees those. They can be auto-generated, they can be a combination of initials and numbers, or they can be a number. Either way, those are usually unique to that personnel, so they won't be duplicated to prevent people from getting mixed up. Just note that that log shall be maintained at the pharmacy for at least 7 years from the date of the initial transaction. In Class A pharmacy, you will come across 4 different types of prescription records. Those are written, verbal, electronic, and fax. All these types of prescriptions have quantities associated with the medication to be dispensed. It is okay for a pharmacist to dispense less than what's prescribed at the patient's request. Also note that original prescriptions must be maintained by the pharmacy in numerical order and remain legible for 2 years from the date of filling or the date of last refill dispensed. A lot of times going into pharmacies, and you will know this on your advanced APPE community rotation, that prescription records will be stored in 3 different files. You'll have one file for C2 prescriptions, you'll have another file for C3 through C5 prescriptions, and then you will have a third file that contains legend and OTC drug prescriptions. Just a quick stop sign here because I feel like this is extremely important and I want you guys to remember this. It is the pharmacist's professional responsibility to exercise professional judgment with respect to authenticity, accuracy, and validity of a prescription. What that means is just because a prescription order is presented to you doesn't mean it has to be filled right away. Take your time, verify its validity, make sure that it's accurate, do your drug regimen review, answer any questions that you might have. But what I really want you guys to do is make sure that you're 100% confident before you fill any prescription. It's not uncommon to see prescriptions transferred between Class A pharmacies, but there are some laws and regulations around that. To transfer a prescription, it must be communicated verbally or via fax directly between pharmacists or from one pharmacist to an intern. In other words, a transfer cannot happen between 2 interns. It's not permitted. It can be conducted electronically for convenience and for ease of use. Controlled substances can also be transferred for a max of 1 time unless the pharmacies share electronic real-time databases. As we mentioned earlier in the example before, between 2 Brookshire's pharmacies, if it's a controlled substance, they can be transferred back and forth as many times as there is allowed of the quantity filled or if the number of refills. It doesn't really matter. But if you're transferring, say, from Brookshire's to CVS, that transfer is only good 1 time. So if the patient gets it at CVS the next time, but they want it back at Brookshire's, that's not possible. It has to stay at CVS. So just an example of that. Another interpretation of the law that's kind of getting some heat lately, but it's being enforced across Class A pharmacies all the way around, and I think the State Board of Pharmacy is kind of looking at it to see if there's any exceptions to this rule, is that before a controlled substance prescription can be transferred, it must be filled at least 1 time at the initial pharmacy before it can be transferred. Now, this even goes into play when pharmacies share databases. So if a prescription goes to one Brookshire's pharmacy, it can't be transferred to another Brookshire's pharmacy until that prescription at least has been filled one time at that initial pharmacy. The same goes for a prescription of a controlled substance being transferred from a Brookshire's to a CVS. It has to at least be filled one time before it can be transferred. Also, after a prescription is transferred, it must be voided in the computer system so that way it can't be filled again. An individual may not refuse to transfer a prescription, so if you call a pharmacy asking for a transfer, they can't tell you no, they have to give it to you. And also know that a transfer between pharmacies must be completed within 4 business hours of the original request. So it has to be done in a timely manner. And then lastly, the electronic transmission or transfer of multiple or bulk prescription transfers is permitted. We're almost there. This is the last topic, I promise. Let's talk about Class AS pharmacies real fast. All Class A pharmacies that compound sterile products must have a Class AS license. So easiest way to remember it, Class A for community, -S means for sterile. So compounding sterile products. This licensure provides the Texas State Board of Pharmacy the ability to identify which pharmacies are engaged. Again, a pharmacy cannot compound sterile products until they have a Class AS license. In addition to sterile compounding rules, Class AS pharmacies must also follow Class A rules for pharmacy. There's nothing like a little fire hose learning for Class A pharmacy. I know that information was coming out fast to y'all like water from a fire hose, but just know it's a pretty in-depth topic, and I wanted to do my best to give you guys the highlights of what to look for in a Class A pharmacy. I know if you don't have much experience with Class A pharmacy going out on your APPE rotation, hopefully some of this will begin to make a little bit more sense, and I promise the more experience that you gain in a Class A pharmacy, the better you'll be able to understand these laws and rules and regulations set forth by the Texas State Board of Pharmacy. As always, email me with any questions at jeremyashley.uttyler.edu. You do have a team-based assignment associated with this lecture. It's going to be a pharmacy law application questions worksheet that's going to be posted on Canvas. It's going to be due Sunday, April 26th by 11:59 p.m. And it is a team-considered application, like I said, so only your team leader is responsible for submitting the team's assignment, so only one per group. Well, good luck to you guys and gals. Like I said, use this lecture, pause, rewind as many times as you need to, and I hope you have a good understanding of Class A pharmacy now. Take care, and we will talk to you guys soon.